This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Toyopharmin 100 micrograms tablet is an essential medication for managing thyroid hormone deficiency. It helps restore hormonal balance in the body. Indications and uses. This medication is indicated for the treatment of hypothyroidism, where the thyroid gland fails to produce adequate hormones necessary for normal metabolic processes. It is crucial for maintaining energy levels, regulating body temperature, and supporting growth and development in both children and adults. How it works. The active ingredient, thyroxine, helps to regulate the body's metabolism by ensuring that energy production and expenditure are balanced. Directions for use. Take this medication in the morning on an empty stomach, ideally at least half an hour before breakfast. Swallow the tablet whole with a glass of water and avoid chewing it. The physician will determine the appropriate dosage based on individual factors such as age, weight, and health condition, so it is essential to follow their guidance. Possible side effects. Some common side effects may include increased appetite, weight changes, headaches, nausea, diarrhea, menstrual cycle alterations, fever, heat sensitivity, cramps, and mood fluctuations. Consult your healthcare provider if these symptoms persist or worsen. Precautions and warnings. Before using this medication, it is vital to inform your doctor if you have any existing health conditions, especially heart disease, as caution is advised. It is also not suitable for individuals with unmanaged hyperthyroidism or adrenal insufficiency. Pregnant and breastfeeding women should consult their healthcare provider before use. FAQs. 1. What is the use of this medication? It is used to treat thyroid deficiency. 2. Can I take it if I have diabetes? Inform your doctor, as it may affect blood sugar levels. 3. When should I take it? Preferably in the morning on an empty stomach. 4. What if I miss a dose? Take it as soon as you remember or skip it if it's almost time for the next dose. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below. We appreciate your feedback.